and at least once or twice while in attendance at them, someone would ask me, "Do you know Russ Nix?" No. They'd follow the question with statements like, "Oh, wow, he's great," or "You really got to meet him. He really knows his stuff." It made me really feel like I was missing out on knowing this guy, Russ Nix. Well, the day came when I got to meet him, and let me tell you, he really does know his stuff. Russ and I have the same overall focus, but we come at it from different perspectives because of our background. Ultimately, our goal is the same, and that is to help facilities that want to become more compliant from a regulatory perspective and become more comprehensive with their drug diversion and monitoring programs. I know Russ and I could share for hours, but this video will be an introduction to Russ, and I will definitely be having him back again. So Russ, can you give us an overview of your background?
Sure. I appreciate the introduction. That is way better than I probably really am, but yeah, I'll definitely give you a little bit of my background. So I did start my career in healthcare security and law enforcement and back in 1999. And my law enforcement experience consisted primarily of narcotics investigations. I actually worked undercover for several of those years. And that's really where my experience and knowledge with opioids and different types of medications started to kind of grow and expand. So I worked undercover narcotics during the early stages of the opioid crisis. And that's really kind of the launching point to kind of where I'm at now. I did that, and then about 10 years ago, I started back into healthcare full time, and I wanted to focus on the opioid crisis from the angle of the healthcare drug diversion aspect. So I had gotten my bachelor's degree in criminal justice, and I kind of knew the who and the how aspects of an investigation, but I got my master's in forensic psychology because I really wanted to tie the why in that type of behavior and addiction to the who and the how. And that's basically where I've been for the last 20 years.
Okay, so when you say that you were in undercover, was that in a healthcare facility or with law enforcement?
That was law enforcement. I worked undercover narcotics for a state drug unit. And then when I was doing that, I still worked part-time in healthcare security and got to see how emergency rooms and prescribing practices and different things like that work. So I had the privilege of kind of learning both as I went.
Okay, that sounds pretty cool. So your career kind of started at one and moved along a little bit, and then your advanced degrees put you in a position to really hone in on an area that you had some interest in. That's pretty cool.
Yeah, when I worked undercover, I kind of I was able to kind of observe some of the darker aspects of the opioid crisis and start to see the effects of the addictive behavior on families and friends, not just the addict, and kind of started, moving me in that direction. The kind of probably more one of the disturbing elements of that was the fact that there wasn't a lot of accountability in healthcare. You were seeing a lot of prescribing and filling and things like that. So it was definitely a learning process for me, but I think it was a knowledge that I really got to use as I continued through my career.
Yeah, what a combination, both hospital and then undercover on the streets. I'm sure we could talk for hours about stories on that. Maybe
Sure.
Stories you don't care to remember.
There are some good stories and some good experiences. I think it's funny when you get me and some of the old crew I worked with together. We talk way more than anybody wants to hear.
All right. Well, during that time, as you know, drug diversion software has come out in the last few years. Do you have any thoughts on the emergence of those software products?
Yeah, absolutely. I really couldn't say enough about those softwares. I think drug diversion detection and prevention software it's a necessity to have an effective drug diversion program. So I think, at this point we see a number of technologies and platforms that are on the market now. Each one of them have their strengths and weaknesses. I do think that the biggest weakness by far, though, would be the refusing or neglecting to have something. I think right now we're in a society where technology is really moving us further as far as workflow is concerned, and so the only downfall would be if you didn't, try to invest in one of them.
Okay. Do you have any hands-on experience with any of those platforms by chance?
Actually, I've been pretty fortunate in regards to hands-on experience with the platforms. I have, between working with basically in actual hospitals and facilities as an employee and working as a drug diversion specialist or with a drug diversion program. Also having worked since then with Aegis with my company, and then also through the National Association of Drug Diversion Investigators and IHFDA, I've been able to get hands-on experience with just about all the major players in the software platform and technology industry. So I've been really fortunate, like I said, to be able to get a lot of experience with pretty much all the big names. So I think that they all have something great to offer, but I've been able to get in and kind of play with the gears on all of them.
That's pretty cool. That's pretty cool. Yeah, I don't have experience with all of them, but I am looking forward to getting that opportunity, hopefully in the not too distant future. You mentioned Aegis, the name of your company. Can you tell us what you offer?
Sure. Yeah, absolutely. So Aegis RX, it's basically it is a healthcare consulting company. We do have a very small part of physical security that we do a little bit of consulting with as far as active shooter and things like that. But we specialize in healthcare drug diversion. That is where my bread and butter lies. That's where my knowledge and training and my experience all come together. The services offered is like your risk assessments, regulatory compliance, such as your DEA compliance or your licensing boards, your boards of pharmacy, your boards of nursing, your mandatory reporting, investigative review and assistance. So some have me come out and look at the overall investigative process and help build it. Others have called me out for particular cases that they would like help with. I also do education, training, policy and procedure reviews, revision, creation, and implementation on policies and procedures. And then, of course, do review and recommendations regarding technology and other detection platforms and investments. So the experience basically comes from having built a program from the ground up. So my first experience, there was absolutely nothing, no policies, no program, no monitoring or surveillance. There was nothing to look at, and that I was very lucky. I was able to get some executive buy-in at that organization. It was Athens Regional, which is now Piedmont Healthcare. Their leadership was fantastic, and they helped me and supported me in building a drug diversion prevention program from scratch. So basically every stage I've been able to learn what works and what doesn't, and that basically gave me I guess a more robust experience to be able to help pretty much at any stage that an organization needs.
That's fantastic. You got a nice overview, trial by fire, and now you can
Absolutely.
pass that on to other people.
I'll take the burn.
Yeah, no kidding. What do you feel is the costs to organizations that fail to have a comprehensive drug diversion program?
My thoughts are pretty simple. Healthcare organizations, they're going to invest money in drug diversion prevention. The choice is whether or not they invest that in a solid, robust drug diversion program up front and put that time in, or if they decide they want to wait for a regulatory entity to come in and dictate the amount of money they have to put into it. there's no doubt in my mind with the evolution of regulation, the evolution of the crisis, that it's going to happen. Unfortunately, a lot of organizations will choose the latter. They'll want to ultimately wait, and they'll spend more money, suffering from the additional things such as your negative press, restrictions and sanctions, and media exposure, and then of course, worst of all, they'll have patient harm, and that's what we're trying to avoid on the front end.
Yeah, you're right. Many organizations wait because they don't really think they have a problem because nothing has come up yet.
It is
right?
it is the head in the sand issue. I actually have had a case at one point with an organization where the individual I was dealing with, the supervisor, continued to tell me that there wasn't a diversion issue. And once I proved through data and monitoring and evidence and even an admission from an individual that there was diversion there, her statement was, "You can knock me over with a feather." And I continue to say this to organizations around and any leaders that are listening, that the issue at hand is that we all want to say we're aware that the opioid crisis is an issue, that healthcare drug diversion is an issue, but we want it to be a general statement and not a specific statement to our organization. And unfortunately, if you have drugs in your organization, then you have a drug problem. It's just that you're not looking hard enough, because if you have medications in your system, then somebody's trying to get them out and use them for something that they shouldn't.
Yeah, I think that's a great example that you just shared of how somebody thought there was no issue at all. And
Right.
with a little bit of your help, you showed them that there is an issue. And that's really what it comes down to. If you're not finding anything, it's because you're not looking, but they are there, right?
They are there.
Yeah. Yeah. No, that's great. Okay, is there anything additional that you'd like to share about yourself or the work that you do, or do you want to turn the tables and ask me a question before we wrap it up?
So yeah, I do. You and I've had a couple of conversations in the past, and like you said, we come from different backgrounds. So I think that one of the questions I wanted to ask you, because I do come from a different background, I have always leaned on the investigative process and how things kind of evolve through an investigation, and what's important, what pieces are the best to make the puzzle work. And because I come from a law enforcement background, we lean very heavily on the investigative interview when we finally get to someone and we want to do an interview with them. And so that's really something that I try to teach when I go in, and is putting, the interview process becomes very important, because obviously that is the conversation you're having with someone who may be addicted or someone who is diverting. You had mentioned in a conversation away from this video that you had also noticed that it's important, and it was kind of a different perspective for you. Can you tell me, as far as my look at it as it being a pivotal piece, what are your thoughts on it, and why do you think it is?
I think it is very pivotal. I have seen things. We get the data that supports there's probably something going on. And it can be even to the point where, like, I am convinced, but obviously I haven't spoken to the person yet. So we still need to do that piece of it just in case there's another reason. And I've seen it completely fall apart because the person that takes over the interview stage is not comfortable, doesn't think there's a problem, doesn't know what they're doing, and then you lose that opportunity, and you've just now alerted that person that there's a problem, right? So I think it's extremely important. I have conducted audits where it is quite clear from the data that there's a problem, and if you're fortunate, it doesn't take much then for the healthcare worker to say, yes, I have a problem. In fact, there have been times I know that at one institution that I went to, we were actually, finding them left and right, quite frankly. And they were taking their badges off and sliding them across the desk and getting up and walking out. And that was that. So you didn't really need to interview. But in other cases, I think it's extremely important. And it's an area that I wish I had your skill set in, because I have not been completely at all really successful in getting admissions. I can see behavior that tells me that there's something going on, but they're not saying it. And so then you rely more on the data to back you up. And that's where then the institution has that decision to make, because they didn't admit, what are we going to do with this and how strong is the data piece? So
Right.
I think the interview piece of it is extremely important.
Yeah. I agree. Absolutely.
Yeah. And we'll have to do a whole interview series on just the interview process and
I like it.
how we handle that. All right. Thank you so much for your time today, Russ. And we will definitely talk soon.
Thank you for the opportunity.